Welcome back. The story of healthcare staffing shortages in Wisconsin isn't getting better, it's just getting worse. And that's according to the latest annual report out from the Wisconsin Hospital Association, and it's sobering news. In fact, 1 year ago on this show, their report did tell a similar story. Now I'm joined by the Hospital Association's Senior Vice President, Ann Zank. Ann, good morning.
Good morning.
It is a little bit discouraging, is it not, reviewing this report? It's a very similar headline to, again, what we've talked about for years in Wisconsin, and then it seems, made worse by the pandemic. So what is the landscape right now?
Well, the landscape right now is that, as we've been thinking about for probably almost the last 10 years, um, is the impact of, what we call the silver tsunami, the aging of that very large baby boom generation that I'm actually part of. We're seeing waves of retirement, but in healthcare, there's an additional challenge because as we age, we require more healthcare, more intense healthcare, and that increases demand on the healthcare workforce. So in just 1 year, hospital vacancy rates have nearly doubled from 5.3% to almost 10%. That's a very concerning situation.
What was it about last year, 2022, that perhaps brought new challenges or made this so much worse?
I think there's a lot of factors. The pandemic brought a lot of issues to the forefront that have been, stewing for a lot of years. Things like maybe people moving up their retirement, which then created that tipping point. Baby boomers are not the predominant generation in any industry's workforce right now. We have a multi-generational workforce, which brings a lot of benefits, but also additional challenges. We have a workforce that is more willing to change jobs and pursue additional opportunities. So employers have to make sure that they present opportunities at their workplace so that they can retain employees. The other thing that the pandemic kind of pushed forward is a nursing shortage for the first time in over a decade in Wisconsin, which really has a disproportionate impact on the healthcare workforce. Nurses have really broad and in-depth training, so they can fill a lot of roles on the healthcare team. So when there's a shortage, we really feel that impact in terms of, access, in terms of needing to pursue creative strategies to make sure that we have staff at every bedside that's needed.
What is the impact to patients in hospitals when you mentioned this a minute ago, there's a 10% or over 10% vacancy rate? What is the ultimate, if I were to go to the ER, if I'm hospitalized, what's the impact to me? What's the impact to viewers?
I think the impact can be longer waits in emergency departments, especially if you need to be admitted to the hospital, because we can have as many physical beds as possible, but if there's no staff to care for that patient in the bed, if we have a physician but there's no certified medical assistant in that exam room, that's going to slow down care. The other issue that really came to the forefront over the last couple of years is, and at times, an almost complete impossibility of finding post-acute care like a nursing home bed. That means that there's patients who are remaining in hospital beds because they just they can't go home yet, and there is no nursing home bed for them. So that also backs up care. That means that patients who could be in that bed are waiting in the emergency department. And so that's also, a staffing issue and an issue that the state is working hard to resolve.
Which kind of leads me to my last question, and I think something that this report takes a lot of time to talk about is solutions, right? So, what is, in your opinion, the strongest or most promising solution that we could look at in order to solve this crisis?
Well, one of the advantages that healthcare has over other industries is that our career pathways are really visible and very well defined. And a healthcare employee can progress in a career pathway that's really achievable, but also um, meets some of the highest needs that our multi-generational workforce of today has: meaningful work, opportunity for advancement, working beside and as part of a team taking care of patients and improving the health of your community.
And thank you so much for your time. It's always good to talk about this issue and, an important thing to bring light on. Appreciate it.
Thank you, Naomi.
We will be right back.